All right, good morning, everyone. Chris and Chris, thanks for coming. People out in the ether, thanks for tuning in. I'm Ryan Lee. I'm a co-founder and CEO of Hire Me Healthcare. At Hire Me Healthcare, we connect healthcare professionals to those who need them most. Now, what does that mean? First, we have to start with the problem. We're looking to address a monumental problem that the last year exposed as way bigger than we all even realized beforehand. And that is a shortage in healthcare professionals. It's a shortage in the staffing industry. There's plenty of reasons and sub-problems that underlie this, but to briefly run it down, it takes an average of 89 days to fill an RN vacancy. That's a national average. Jobs remain open, nurses are needed, but they're not there. One of the best ways to fix that is through travel RNs. That's an expensive process. We're not trying to take away from the travel RNs, but the extra cost added when you fill that position, doubling the hourly wage, that doesn't go to the nurse, that goes to the agency. That's a cost hospitals do not need to be wasting when there are more efficient methods. So for every 20 travel RN spots that could have been filled, hospitals could save on average $3 million. And this need is consistent and growing right now. The shortage is not going away. The national RN vacancy rate is 9%. And that sounds small, but there's 3.8 million nurses in this country. 9%, it's actually 9.9. We went conservative, but that's 380,000 vacancies. That's 380,000 people that could be helping saving lives around our country. The turnover rate is 15%. So additionally, people are changing, people are moving. They're moving to new cities. We see it in Charlotte all the time. And yeah, there were 3.1 million RN jobs before COVID. That's expected to grow. It has grown up to 3.8. So Hire Me Healthcare wants to step in with a solution. We developed a web and a mobile-based platform to make this easy. We instantly connect healthcare professionals to job opportunities in their immediate geographic area. Think of us as an Indeed crossed with Zillow. It's a chance to reach out on both sides. It's a two-sided marketplace for us. We have the supply side of healthcare professionals, and then we have the demand side of the hospital systems, the private clinics, and the nursing homes, all looking to find people. So through this process, you can see this. We're working with dual boot partners right now to develop. We're in an early stage. We were founded by Trey Ennis. He has his background working in the operations department of, won't name one of the largest healthcare systems in North Carolina. And the reason I won't name is because that's where he observed the problems that we are looking to solve here. He saw overqualified, perfectly qualified applicants sliding through the cracks because they didn't meet the algorithmic blocks that it takes to get to your resume in front of the proper hiring manager. And we partnered with Dual Boot after running a couple beta tries. We've been de-risking this over time, finding proof of concept. We partnered with Dual Boot, who's, as you saw in the advertisement before, they're a major developer here in Charlotte. They're doing a fantastic job. We're in the final stages. We're launching in just a couple months this summer. We have the mobile platform. If you see that's, you can see the map component there. That's where we get the Zillow. Right now, healthcare professionals have to find jobs based on who paid Google AdWords the most. And that's not the way you want to decide your livelihood and your future. On the hiring side, we put all of the healthcare industry's most valuable fixed asset. It's human people, it's human capital right in front of them. So far, despite having not fully launched, in our pre-launch and our beta phases, we've made 30 placements and counting. We've experienced 5 times the click-through rate of Google, and we've experienced a 3 times faster fill rate. That takes that 90-day average down to around 27 days. We want to focus right now on why we are going to win. We're not pretending we're the first people to invent an industry-specific platform for hiring. We're not inventing the wheel here, as much as I wish we were. But Hire Me Healthcare, we are focused on North Carolina. We know that to get off the ground here, we need to focus on a niche. This starts with our team. We're all Charlotte natives. You don't hear that very often anymore. We have Trey, who I already mentioned with his background in healthcare operations. Almost said the facility again. My background is in entrepreneurial law, business, venture capital, and the humanitarian side, which is actually why Idea Fund is so interesting to me. I have long-term goals of finding a way to apply this in the humanitarian context, but that's way down the road. Through our focus in North Carolina, we have a database of over 190,000 nurses. That's every nurse in North Carolina. It's updated quarterly. We have the means to access. This is clunky. We just got a pro forma done of our revenue model. The most important part to see here is that it does not take many placements for our gross margins to go up. There are 11,000 plus vacancies in North Carolina right now. We do not need to fill a ton of those just to get into revenue. We're planning on a waterfall slide as soon as but we just got this pro forma done with our fractional CFO. We're in the process of raising a SAFE. We're 180K through 500, 3 million valuation cap. This has mostly been through friends and family. We're looking to close the rest through angels and anyone else interested. The biggest part of that is growing our team. New hires, someone with a healthcare background to run our sales department, someone who speaks that lingo, someone to recruit our nurses and build our brand on both sides. So I know I'm out of time, so thank you all, and we're Hire Me Healthcare.
So could you go back one chart?
Yeah.
So this says that you're going to sell seats?
Yep.
And right, so who are you going to sell those seats to?
So the seats would be hiring managers. So there are 2,800 private practices in North Carolina alone. I believe it's 560 plus nursing homes and about 160 hospitals.
Okay.
Hospitals would average probably 4 to 7 depending on the size.
So 49 is like what's the big market that's a derivative of? 5,000, 3,000? Like what are you talking about?
A lot of the early stage seats we're going to be looking to private practices and nursing homes. They don't make as many hires in the beginning, but it's just a larger market to go through, and the sales cycle is a lot longer for these major healthcare systems and their red tape.
So I'm saying if you gross all those up, like what's the total market that you'd be pulling those 49 seats out of? Do you know?
The total market in
North Carolina.
I don't know exactly how many because it's a number of how many hiring managers. And right now, I can tell you, again, I'll avoid names, but one of the large healthcare facilities here just turned over their entire system and is changing their hiring practices, and now they have a different number of hiring managers. I would say in North Carolina alone, it's probably around 2,800 facilities, so they at least have one person in each. I would say it's probably around 4,000 or 5,000.
Okay. Right. And they're going to pay a monthly fee to you in exchange for using the software?
Yeah, we're easing into these 5-minute pitches. I did not get to our pricing structure.
You're doing great. You're doing fantastic, right?
But our pricing structure is a monthly subscription, and then we're going to take a percentage of 5 or 10%. We're still workshopping that in our market research of the first year's salary.
And so how much do they pay for a seat?
For a seat, it's $250 a month.
$250 a month, and then you then take 5 to 10% of the salary of the people that get hired.
Yep.
The first year. Okay, good. Right. And how many placements get made in North Carolina every year?
Well, it's the 15% turnover rate carries here. So out of the market of 190,000 total, it's between 15 and 20,000, I believe.
Okay. All right. Good.
So one question that I have is, so the problem is defined as, X number of healthcare workers shortage, right? And the solution is centered around, let's call it a job board. Let's just make it to oversimplify it, perhaps. I guess the question is are there these nurses that are out there that are unemployed, right? That are just man, I can't find a job. And now all of a sudden they have a place? Or is it because there aren't enough nurses? So I guess I'm trying to connect the solution to the problem. My wife is a nurse, and she's squarely in the, I don't want to go back to nursing bucket, right? So she's probably one of the people you might count in this bucket as causing some of this shortage, but it's not because I don't know that she's ever had she probably could get a job this week is probably the way she's always thought about it as an RN. So I'm curious, when you go to a healthcare provider, let's say, are they saying, man, we are just having a hard time finding applicants? Are they saying we're having a hard time finding good ones? Or I'm finding a disconnect between the problem and the solution.
Yeah, well, there is a margin of error in there because, there are some RNs that just say, I'm done. But that pool lowers when they don't recertify. They're not going to keep their certification. I didn't keep my law license when I was living overseas, kind of thing. I think the two indicia are the vacancy rate in hospitals and the turnover time. So the fact that there are these 380,000-ish national holes, and it takes 90 days to fill them, and they're scrambling to outside components to do it. It's not for a lack of a stack of applications, that's for sure. It's for a lack of efficiencies in the system, and that's essentially what we're trying to do. Essentially, put a career fair of applicants and hiring managers together where everyone can see everyone. The hiring managers can see everyone who's qualified and connect easily, and we've shown that does dramatically reduce the turnover rate. And I think that these positions would fill quicker, because when they're empty, if it takes 3 months to fill them, that number is going to aggregate.
That to me is the lead-in, right, from the problem is there's inefficiency in hiring of nurses that causes a shortage, right? So today it takes 90 days to hire a nurse. They have stacks of applicants, but there's inefficiency in the hiring process. Through this solution, we expect to shrink that to X, and therefore employers are happy, we're better staffed, et cetera, right? Because I think that strikes me as the problem solution match that I'd be looking for.
Okay.
And if I can, so then that means that really your customer are the hirers, right? That's really who you're focused on.
Right.
Because you're saying they've got enough candidates today, right? But just sorting through them is too hard. Okay.
Yep.
And that flows through to the revenue model eventually.
I'm a little skeptical of that. To me, if you could illustrate that while you're talking, to say, let me give you an example, right? This is why it's hard to be a hiring manager for RNs today. Because if anybody's hiring now, the problem is not too many candidates. Right? The problem is not enough candidates.
Exactly.
And so for me to imagine a hiring manager who's got 250 candidates and they got to get through them, well, give me that problem, right? I would take that one, right?
Yep, and that is part of our market research. It does not actually make sense on its face. If there's enough applicants, and you should be able to filter, you should have a system in place that filters through the qualified ones and are able to make that connection the way a lot of industries do. And we're still getting deeper into exactly why the specific pain points do vary by hospital and clinic, but overall it is kind of a phenomenon, but it's clearly taking place, and I'll do a.
And I do wonder too, the other element is how nursing is flowing. I think about my wife's career. Most people start in the hospital because they get the most experience, and then they're like, I'm never going back. I'm never working at a hospital. There's some people who love the extra comp that generally comes with working at a hospital, but most nurses that I've ever run into hate the stress and understaffing and sort of businessification of healthcare that happens in a hospital. And so then when they can find an ambulatory or a clinical setting where they can move off, it's a little bit less stressful. So I'm almost curious, again, if you were to say, here's how nurses are flowing, if this might be a solution for clinics to almost capture all of those nurses that kind of want to move out of that particular
Absolutely,
segment.
Chris. And that is why we want to focus a lot on the private practice side, because as people do transition, our focus a lot with the nursing schools is a lot of the hospital jobs, because as you said, that's usually the entry point. So when we go to them, that's kind of the candidate pool that we're trying to bring to these sales cycles with the major hospitals. And then the flow continues as well. There's a giant home health market that we know not to bite off more than we can chew in the beginning, but the idea of funneling a lot of practice applicants or people in the later stages that still want to make money, or that 3 days a week, 3 12-hour shifts is not enough for them. They have time to make extra money. The home health sector, and experienced a lot of that personally lately, how important that is. It is a flow, just like you said, and we're as we grow into these stages right now, we're looking to master that and figure it out.
Observation too is, so this is a pitch, right? And so pitches tend to be high level and visual, and tell me a story. And it generally flows something like, this problem exists, we have a solution, let me tell you about the product, let me give you a sense of the market opportunity, here's what's innovative about what I'm doing, here's how I plan to go to market and make money, here's what I've done, here's my team, here's what we've done to date, and here's what I'm asking, right? It's there's kind of this storyboard that you flow through. So I think, the more stuff you put on a slide like this, right? So if I were to say, what would you, for a financial slide, I think I'd rather see something that's centered around, hey, this is the number of seats and revenue or something, projections, right? Because
a little breakdown of, this is how we're going to go make money. we're going to sell seats to these providers and then take a cut of the salaries when they hire people.
Yeah, because I didn't get that.
Yeah, because
Yeah.
and like in this chart, it's great, right? This like I don't super believe this one.
I was
right?
just gonna
and
say
so
that,
and so like it's like this should be the plan and let's aim for it. If it's me, I'm not pitching this
Right.
to an audience.
Yeah.
Right.
No, and I did not intend to do that.
it's
Actually,
fine.
I actually had a
Yeah.
personal
Yeah.
emergency
No.
that took me away all day yesterday, so this is all I was able to get in last
You
minute.
did great.
Sorry.
This is
Totally.
Good. Yeah.
I think the one thing is like thinking about a pitches are just like a means to get to the next
all it
deeper
is.
conversation.
Yeah.
And so the thing that I'll do is when I'm looking at a pitch, I'm almost finding, because I have to sift through 2,000 deals a year, I'm finding a reason not to have the next conversation. I need to like focus my time. So I'd be honest, I'd look at this and I'd go, so let me get this straight. You're going to make like a 90% margin. Either you don't need me, I don't believe
You're
it,
right.
or you haven't thought enough about this, so I'm going to pass, right? But if you were to just say, I make money these ways and we think we can get 400 or 500, I'd be like, okay, that seems believable, right?
And by the way, Ryan, you know the answer to all the questions that belong on the slide that replaces this because you said them to me, right? So you know, like you've got it all,
Yeah.
right? I just think this is something that y'all have in your appendix, you know,
Yeah,
for later.
absolutely.
And what you want is the high-level thing that says, let me just show you
For your
kind
data
of how we do
room.
it. Yeah, right.
Yep.
Absolutely.
For
Yeah,
sure.
this was with much reluctance. That
Well-
hurts my head to look at.
And I'll tell you, like, I sit on the 4th floor of an office building with dirty windows, Andrew. And
Except twice a year.
right, well, like in April, there were 2 people sitting out under a little umbrella by the little parking area during COVID, kind of still just post-COVID. And I was like, what in the world are these people doing? So I went down and asked them, what are you guys doing? And they said, we're recruiting nurses. I'm like, you are? Like, this seems like a terrible way to recruit nurses because you're sitting in a parking lot, right? And no one came by to talk to them. So there are people out there who feel this problem so much. And like, if you could illustrate this problem by finding somebody who's got this pain and put their words like into your pitch, I think it would really it would help.
Did you get the contact of those parking lot people?
I know exactly. Below us.
Nice.
I'm serious. See me after class. I'll tell you where they are.
Absolutely.
Tell it, yeah. Perfect.
Awesome. Thank you, Ryan.
Thanks.
Yeah. Thanks.